Welcome to Get Over It, the consciousness transforming podcast for exceptional 21st century living. Today, folks, we have part 3 of our 4 weeks of Reiki, and we're showcasing some of the Reiki masters participating at the Wisdom of Reiki conference, an immersion for Reiki practitioners. And this is going to be held at the Omega Institute in Rhinebeck, New York, from September 23rd to the 25th. The presenters are going to be William Lee Rand, Stacy Gibbons, Brett Bevel, Raven Keys, Michelle Denis, Helene Williams, and myself. And today I have the extreme pleasure to speak with Helene Williams. So, Helene, how are you?
I am great. Thanks so much, Monique, for having me on the program. Very
Oh,
excited to be here.
yes, I am thrilled. I'm thrilled to meet you, and I'm also thrilled to be a part of this amazing event at the Omega Institute. So tell us a little bit about yourself. How'd you become a Reiki master? How long? What's your specialty, if any? Talk to us about Helene and what you're presenting at the conference.
Yeah, so actually, a lot of people have stories about how they sought out Reiki, and
Mm-hmm.
Reiki actually found me. So I was looking for another job. I'm a registered nurse, and I had done hospice nursing for 5 years. And I was getting to the point where I needed to kind of do something else because I was
Mm-hmm.
getting a little bit burned out from that, although I loved it. And I went to a job fair. I met this wonderful nurse manager on a total joint replacement unit, which would probably have been my last choice. But I
Mm-hmm.
loved what she was talking about. She was talking about things like Reiki and aromatherapy and music therapy and guided imagery and bringing all these kind of things in for the patients. And so I was like, I want to work for that person. And so I signed on, and probably I wasn't even there a month. And she brought a Reiki master in to train those of us who were interested. And that
Mm-hmm.
was how I got introduced to Reiki. I'd really never heard of it before.
Mm-hmm.
So I learned Reiki, and I really connected with it. And pretty soon afterwards, my manager was saying, okay, now you have to become a Reiki master. And so I kind of did
Mm-hmm.
that sort of quickly. I found somebody locally who trained me, and she was amazing. Her name was Kate McCusco,
Mm-hmm.
and we became very good friends. And then, like a year or so later, I went out to Sedona. I met Laurel Shantigaya, and so I was also a Reiki master through that lineage.
Mm-hmm.
And I've also taken classes from Francina, and that's currently how I practice through that lineage.
Mm-hmm.
And so I've been practicing since 2007.
Wonderful. What a story. I mean, you just like literally fell into it.
I
It's almost.
did. I did. And I was a little hesitant to use it, as a matter of fact, initially, because it was pretty new in the hospital at
Mm-hmm.
that time. I live in a
Mm-hmm.
pretty small town. And one day I had a patient come up after joint replacement surgery, and we had given him everything we could possibly give him for pain. And he just looked at me and he said, can't you please do something else? And I was like, okay, here we go.
Mm-hmm.
And it was pretty amazing because he was asleep in 10 minutes after the Reiki
Wow.
session. Yeah.
Mm-hmm. And so if you didn't really believe in quotes before, you believed at that point. And how did you or do you introduce Reiki to, people today that are looking for healings?
It's been very interesting watching how Reiki's grown in the
Mm-hmm.
last 15 years or so. And, it's really not so much me having to explain it anymore. It's people just coming and seeking it out, which, especially since COVID, I found my Reiki
Mm-hmm.
practice is incredibly busy. People are just calling every day. They're emailing. They want to experience Reiki. They're not always sure exactly what it is, but they know that it's something that can help them. So, I used to be doing a lot of health fairs and things like that because I'm a nurse, to introduce people in that way. But more so nowadays, people are just calling and emailing and asking for it.
Now, are you doing, since it still is technically COVID, are you doing in-person sessions or are they distance attunements?
I'm doing all in-person sessions now. I'm not
Mm-hmm.
doing many distance sessions at all now anymore. I was doing um, distance during COVID, but
Mm-hmm.
if people request that, wear masks during the sessions, but otherwise, no, in-person sessions, and everything's been going very well. Now in the hospital, that's different.
Mm-hmm.
So the Reiki program is not in the hospital any longer because of COVID. And I found that's kind of the case. I've actually just called around to a lot of the hospitals throughout the country to see where their hospital Reiki programs stand. Some of them have started up, but not all of them, because a lot of them are volunteer programs.
Mm-hmm. Well,
And so,
you
yeah,
go ahead.
go
No,
ahead.
go ahead. No, please go
Um,
ahead.
yeah, asking volunteers, they want to, when volunteers come back into hospitals, they want to make sure it's completely safe for them.
Okay. Well, it's going to be really important for you at the conference to connect with Raven Keys because she's looking to
Yes.
introduce and find financiers for Reiki so that a program can be developed to institute in hospitals, but funded by, wonderful people who want to donate their money to the cause. So I think you
Yes.
two would be a great match. Now, talk to us about what you're doing at the conference.
So actually at the conference, I'm going to be facilitating the Reiki share for the participants at the conference. So in 2019, I was at the conference as well. And Brett had said, hey, I know that you run a community Reiki clinic. Would you be willing to run the clinic then? And it went so well. He invited
Mm-hmm.
me back to do it again. For 7 years, I ran a community Reiki clinic in this it's a little town, but it's a nice sized town that I live in. And we would have this clinic once a month.
Mm-hmm.
All the practitioners were volunteers, and we had 8 massage tables set up in a large conference room, and people would schedule appointments, 25-minute sessions. And so we would see 8 people at a time, and we would see 32 people in one evening. So I was the facilitator of that for 7 years. And so I feel very comfortable in that setting, just having people come in, be at ease, and facilitate the session. So that's what I'm going to be doing at Omega. So I'm not going to be speaking, although I
Mm-hmm.
don't know, I might be just a little bit in the very beginning at the first part of the first session.
Yeah, well, of course, you'll be part of the panel, right?
Yes, I'll be part of the panel. Yeah,
Yeah.
yeah. So
Um,
that'll be
um,
exciting.
yeah, I'm really looking forward to it. It seems like it's going to be a lot of fun. It'll be my first time there, but it seems like, just all of these like-minded people coming together and all the healing energy is going to be wonderful. I'm originally from upstate New York, not too far from Rhinebeck, and the energy can be extremely positive and uplifting. I mean, it's just truly amazing about the energy in that area. And now that more people are open to spirituality and healing, alternative healing, it's like, yes, this is going to be great. So, Helene, how do people work with you one-on-one, or do you work with people one-on-one? And talk to us about your website. Tell us what it is and what's offered.
So I offer classes and sessions. I'm also a mindfulness teacher, so I offer that service as well. I'm
Mm-hmm.
going to be teaching an in-person one-day mindfulness retreat on November 5th. So if anybody's in the Lancaster, Reading, Pennsylvania area, you can sign up via my website at helenewilliamsreiki.com.
Mm-hmm.
The classes that I'm teaching for the rest of the year are fully booked, which is amazing. Also,
It's wonderful.
again, people are just honestly, I have a waiting list for all my classes.
Mm-hmm.
It's pretty exciting to see this and be here in this place and time where people are so receptive to Reiki. So my Reiki sessions that I offer in person are 30-minute sessions or hour-long sessions.
Mm-hmm.
And a lot of people come to me because I'm a registered nurse. And that's not my hat in my office. So my hat is, is as a Reiki practitioner. But
Uh-huh.
sometimes people say, I'm coming to you because I feel like I can trust you because you're a nurse, which is really nice.
Yeah.
Um, And they feel comfortable, and they feel comfortable explaining any medical conditions they have, which again isn't really, it's not relevant, but it helps them to be comfortable. And so I'm really glad that I'm able to offer a space, a beautiful office that I have, where people feel comfortable with me. And we usually chat for 15 or 20 minutes before we start a session. And then we do the session, and then we kind of, I allow the client to process afterwards, what did they feel? Did they experience? And then we just, talk about that experience for them.
My first session getting a Reiki healing was I went and got the healing, and she goes, "Okay, you're done, get out." And I'm like, well, she wasn't that blunt about it, but I was like, but, my head was still someplace else and my body was someplace else. I'm like, oh goodness. So I'm really happy to hear that you give people an opportunity to process and then ask questions if they, should have any. Now, question for you. I haven't explored your website thoroughly, but do you offer continuing education units for nurses?
I am up until September. And I did that for years. I think I'm letting that run out this year, but I was, in September, I still have one that I offer continuing education credits for nurses and for massage therapists.
Okay.
So yeah.
So folks, if you want to get it and you want to get it from her, and she's absolutely gorgeous. Her energy, and I haven't met her yet, folks, but I did look at her on her website, and she's calm and she's cool and she's collected and deep healing. When I looked at her, she was bright orange all over the place. And for me, that's healing. So she's truly a healer. She may be a nurse in training, but she's truly a healer. So Helene, thank you so much for your contribution to Reiki and to the world for healing, because I truly believe that people heal themselves when they're ready. We're the facilitators, but I really appreciate you holding that wonderful space.
And I appreciate that, Michelle, that, we are the facilitators. We're holding that space for people to do their own healing work. And that's really one of the things I like to emphasize when clients come in to see me. Our body has an amazing capacity to heal itself.
If we let it.
Yeah. If we let it.
Yeah, we block it, unconsciously, subconsciously in so many ways sometimes, and it's hard for people to understand. But I want you to give us a pearl of wisdom, because our time is almost up here, and mention your website again, please.
My website is www.Helene, it's Helene, Williams, Reiki.com. Oh, and I also, one other thing, just one other little plug, I offer mindfulness meditations and Reiki meditations every Sunday evening from 7 to 7:30. It's all by donation, so you don't really have to give anything. If you want to sign up, just subscribe to my webpage, you'll get the emails. And I'd love to see new faces every Sunday evening, and that's Eastern Standard Time.
Okay. And you know what, folks, if you give a healing, you get a healing, you get a healing, you give a healing. So, take her up on that. It's time for us to truly heal ourselves. I truly believe, like this COVID and the monkeypox and everything else that's out here that they're throwing at us, it's here for us to open the door for self-healing, open the door for alternative healing. Not that allopathic medicine is bad. It's not. It's definitely needed. But there are other avenues to get to where we need to be. So please give us a pearl of wisdom for our audience about healing.
I guess my pearl of wisdom is that, be open to new things, be open to new opportunities for healing. There's Reiki, there's acupuncture, there's aromatherapy. There's so many opportunities for healing now. We live in a very unique time. So I would just say, be open, walk into situations where you might be able to heal yourself in a way where you have no expectation, and just be open to healing. And
I love
it's amazing what can happen when you do that.
Yeah, and I love how you said no expectation. It's like coming as a blank slate and taking the energy. And since Reiki is so intuitive, allowing the energy to go where it needs to go and allow it to heal. Sometimes, again, unconsciously, subconsciously, we're holding on to whatever condition, I'll say, that has come to visit us. And we're not ready to let it go, but we can let it go. So Helene, thank you so much for your time today. I greatly appreciate it.
Thank you, Monique. It was really a pleasure. Looking forward to meeting you in person at Omega.
Yeah, we will see each other in Omega. And for the audience, thank you. I'm truly honored and I appreciate your time and attention. And remember, folks, that the most important choice that you can make is what you choose to make important. Consider making the masterful choice of Reiki healing. Abundant blessings, light, and love to all. Agape.